So this is Paul, and today what we're going to be doing is doing some rejuvenation around the eyes. And so we've already done some marking here, and so we'll talk about what we're seeing. So Paul's concern is that he has these deep areas right underneath his eye. So they're all hollowed out. He's got some darkening here. He's got this circle that you can see. And it just makes him feel like he's tired all the time and not having any energy. So what we're going to do today is kind of rejuvenate that area. The way that that's done is by adding volume in a couple of different levels. So you can see here we've got a mark right out here. And what we're going to do here is we're actually going to add volume out into the cheek, and that's going to start building up the tissue from below. And so we'll start to see volume come up into the cheek and widen out this area here. So you can see that it's a little bit flat here. We're going to give him back some height into his cheekbone. After that, then we're going to come back in and we're going to feather this out so that way it's all nice and smooth and we can get rid of this semicircle or kind of half moon appearance to the lower eyelid. You can see these markings up here. One of the things that will happen is you'll lose volume in the temples. So Paul doesn't have a lot of volume loss here. Kind of marked out a little bit that he has here. And then you can see that he's got some volume loss up here in the forehead. And it's almost triangular and kind of on both sides. And so we're going to go ahead and add that volume back, and that will rejuvenate the entire complex right here. The first place we start is actually by adding volume back to the cheekbone. And you can see how we've marked this off. And really what we're going to do is we're going to recreate this line that forms from the nose all the way up to the top of the ear. And the highest point tends to be right here, just lateral to the lateral orbit. And so we've marked that off on both sides, so that way Paul's nice and symmetric. And we'll go ahead and we'll add volume. And this goes down right onto the bone. So the next thing we're going to do is we're going to add some volume right in this area here. And again, what we want to do is add that volume from below. We're going to lift all of his normal tissue up. The filler is actually down right on the bone, and so he won't be able to feel it at all. You can see as we're adding that volume, you can start to see that tissue start to expand, lifting everything up. Once we have that in, and we just kind of massage it. And this product is so nice and soft. We're using Juvederm, and you can see just a little gentle massage, and this will fill right in. And you can see that big deep hollow that was there, you can see the top of it is almost flush now this side. How was that? So we're going to add a little bit of volume up here. And you can see that volume just sort of fill that space up as we inject. So again, this filler is sitting right on top of the bone. And the advantage of that is that when you feel here, all you're going to feel is just Paul's forehead skin. So you're not going to feel any filler at all. Feather this out so that way it's all nice and smooth. And so it tends to work best if we start from the side. And you can see how that volume is starting to just kind of flow right into that lower eyelid. And then once we have that, then we just kind of massage that volume right in like that. You can see that big, deep area that he had is almost completely gone now. Our goal with filler is always to leave our patients with a nice and normal look. We never want the filler to be obvious. So that's why we take our time and just kind of gently bring that filler and kind of sculpt it in. So one of the important things for Paul was he wanted to still look like himself. And so one of the things that we want to try and do is just make sure that when we believes he looks better. So we've finished up on one side with Paul, and so we've added that volume in here. We've added the volume up here, and you can see how much nicer that contour is. How this deep sort of half moon is almost completely gone. Now, one of the things that you'll sort of notice here is that whenever we put filler in, it does take a little bit of time to completely smooth, so it's a little bit irregular. That's going to improve over about 24 to 48 hours, and when we see Paul back, this will all be smooth and all nice contour for him. So let's go ahead. We're going to do the other side now, and really kind of the same idea as what we were doing on the other side. So that's 4 syringes on each side, and so we have pretty close to a full correction now. Oftentimes what we'll do is we'll let this settle in, and then we'll have our patients come back in a couple of weeks if we need to fine-tune things. What happens with all of these products is they tend to attract water. So the hyaluronic acids like Juvederm will attract water, and as it attracts water, this will tend to smooth out even more. So you can see just a little bit of irregularity right here, up in here, and that'll all smooth out over the next 24 to 48 hours. Juvederm has advantages of being very safe. As we talked about, you can actually dissolve this product. So if you wanted to get rid of it, you could. It's nice not to have those big, deep circles. I was going to say, what people attribute that to is that you're tired. You've got no energy.
Or old.
All right, let's dry you off, and then let's take a look. Yeah, I think
not bad. Out of all those needles, it's not too bad.
Good.